Today I am going to talk about common behavioral problems of children. What is behavior? Behavior is the action or reaction of something under specified circumstances. And what is a behavioral problem? Any behavior that disturbs the individual's ability to function adequately will constitute a behavioral problem. There are a lot of types of behavioral problem uh, depending upon the age group of children. For infancy, feeding problem is there, colic problem, and stranger anxiety, breath holding spells, and temper tantrum. Temper tantrum is a very serious one that we will discuss little later. First, we will talk about the initial problems of the infants. And mid childhood, the problems are stuttering, pica, sleep problem, enuresis, encopresis. These are all certain medical terms which you need not concentrate more on this. For the preschool child, this will be hyperactive or restless child, head banking or body rocking, thumb sucking, nail biting, and lack of clarity in their speech. These are all preschool problems. Adolescence, it will be jealousy, sibling rivalry, and juvenile delinquency. These are all the adolescence problems. Now we will talk about feeding problems. Underfeeding caused by improper feeding techniques such as decreased frequency or duration of feeding. Inadequacy in quantity or quality of feeding. Early introduction of tough feeding. And then the nipple confusion, breast problem, improper burping, abnormal mother-infant bonding, chronic systemic illness in infant, and overfeeding caused by parents' ignorance about the nutritional requirement of the children, upwelling of the mother to breastfeed, and reliance on bottle feed. That is the thing to be noted. And nursing management, under that the parent should be counseled regarding daily dietary allowance and teach the parents about feeding technique and type of food to be used. And then adequate and expulsive breastfeeding can overcome the problem of overfeeding. And what is head banking? Head banking is this involves rhythmic hitting of the head against the solid surface, often the crib mattress. This occurs in 5 to 6% of the children during infancy and toddler years. This is common at bedtime, before going to sleep, or after the child wakes during night or in the morning. Head banking typically occurs with the child lying face down, banging the head down into the pillow or mattress. In upright position, the head is banged against the wall or headboard repeatedly. Head banking usually disappear within 18 months and might do so as little as weeks or months. Banging can result in callus formation, abrasions, and contusion can occur at the site. And then let's talk about the colic. The colic is characterized by intermittent episodes of the abdominal pain or severe crying in young infants who are otherwise well. It usually begins in 1 to 2 weeks of age and can persist till 3 to 4 months of age. The crying usually occurs in the late afternoon or evening. The clinical features, the attack usually begins suddenly with a loud cry. The crying occurs continuously and may last for many hours. The face becomes red and the legs are drawn up on the abdomen. The abdomen becomes tense. The attack terminates when the infant is completely exhausted. Colics start happening within the few weeks after the birth, reach a peak 4 to 6 weeks, and subside by 3 to 4 months of age. Then comes the strangest anxiety. So, by about 6 to 7 months, the infant can differentiate between the primary caregiver and others. Thus, at this develop fear of unfamiliar people or strangers. The infant, when approached by some unfamiliar person, turns away, even cry or run towards the primary caregiver. This is known as the stranger's action. If toddler seems scared and upset or wary when other adults approach her, do your best to reassure her that everything is okay and stay within arm's reach. When the toddler stranger anxiety sets in, it's key to make it clear to your child that she is safe by holding her or staying close to her. And be sure to give her lots of love and affection as she gets accumulated or reacclimated to the new phase. And coach your friends and family. Let everyone know that your toddler needs a little time to warm up to people. Explain that it is best not to rush in and pick her up and demand hugs and kisses the minute they see her instead. Tell them to play it cool for a bit, and then maybe after your toddler seems comfortable, offer her a favorite toy to entice her to connect with them. Then comes the breath holding spell. What is breath holding spell? The breath holding spell is an involuntary pause in breathing and sometimes accompanied by a loss of consciousness. It usually occurs in response to an upsetting or surprising situation. What are the causes of this? A small number of children have severe spells. Usually, the spells stop by a time the child reaches the age of 6 to 8 years. Breath holding is seen in some normal children from as early as 2 months, but it can start as late as 2 years old. Although they often occur with tantrums, breath holding spells are not thought to be a willful act of defiance. The children with iron deficiency anemia may also have increased episodes of breath holding. Breath holding spells appear to be response to fear, pain, a traumatic event. A sudden reaction can cause the nervous system to temporarily slow the heart rate or breathing, causing breath holding and color changes. The symptoms are bluish discoloration of skin caused by the lack of oxygen or loss of skin color, crying and then stopping breathing, momentary unconsciousness or fainting, short scissor like movement, 1 or 2 jerks. If your child has an iron deficiency, should start iron replacement treatment. When a spell occurs, be sure that your child is in a safe place where or she won't be hurt during fall or a brief seizure. After the spell, try to be calm. Avoid giving too much attention to the child because this can reinforce the behaviors that led to the breath holding spells. And let's talk about thumb sucking. Thumb sucking is a normal in babies and young children. A natural sucking instinct leads some babies to suck their thumbs during their first few months of life or even before birth. Babies may also suck their fingers, hands. Why do babies suck their thumbs? Babies have a natural urge to suck, which usually decreases after the age of 6 months. But many babies continue to suck their thumbs to soothe themselves. Thumb sucking can become a habit in babies and young children who use it to comfort themselves when they feel hungry, afraid, restless, sleepy, or bored. I'll repeat, when they feel hungry, afraid, restless, sleepy, or bored. Thumb sucking is normal in babies and young children. A natural sucking instinct leads some babies to suck their thumbs during their first few months of life or even before birth. Babies may also suck on their fingers, hands, or items such as gloves. And what are the complications that arise out of the sucking thumbs? They get teething problems, respiratory problems, gastrointestinal problems, palate changes, teeth pushed forward, buck teeth, and dental bite problems. Then let's talk about nail biting. This is a habit of biting or eating nails most of the time. It is usually diagnosed after 3 years of age. It is more common in girls than in boys. This is found in socio-economic classes. The peak age for the development of this disorder is 5 to 7 years or 13 to 15 years. Nail biting may be a learned behavior. The causes may be it's developmental causes or emotional factors. Developmental causes is this disorder is common in biting stage and teething stage as a gratifying oral habits. Emotional factors is these include tension, anxiety, parental neglect, strictness, stress of exam, and excessive fear. I'll repeat these emotional factors. These include tension, anxiety, parental neglect, strictness, stresses of exams, and excessive fear. The complications are the teething problems, respiratory infections, gastrointestinal infections, cosmetic problem infection in the bone of his fingertip. Then let's talk about temper tantrum. What is temper tantrum? A temper tantrum is a sudden, unplanned display of anger. It is not just an act to get attention. During a temper tantrum, the children often cry, yell, and swing their arms and legs. Temper tantrums usually last about 30 seconds to 2 minutes and are most intense at the start. And the causes for this is parental factors. These include overprotection of child and inconsistent behavior of the parents. Child personality is the disorder is common in active, energetic, determined, resistant children and in case of feeling of insecurity. Other causes are these include sibling jealousy, physical illness, psychosocial problem in family, lack of play, and organic disease. The clinical features are screaming, hammering, stamping feet, thrashing arms, kicking, thrashing on the floor, strikes people, throws things, and be oversensitive. How to manage this? This disorder ceases with age. A thorough physical examination should be carried out to explore organic disease and treat it as early as possible. Look for any faulty habits regarding eating, sleeping, elimination, and these must be corrected. If there is a lack of play opportunity, then ample opportunity for play shall be provided. Tic disorder. What is tic disorder? Tic is a problem which is a part of the body moves repeatedly, quickly, and suddenly and uncontrollably. Tic can occur any body part such as face, shoulders, hands, or legs. It is a disorder of movement in children. It is prevalent in 12 to 20% of the children. The peak years for this disorder is 5 to 7 years. It is more common in boys than girls. Then facial tics are commonest, followed by neck, eye, and leg tics. Hyperactive child. As the name indicates, the excess of activity. This is commonly characterized by fails to concentrate on work, acts before thinking, shifting quickly from one activity to another, inability to sit quietly. Reward child for only small amount of work and then gradually helping them to increase attention span. These children are odd on toys. Toys should be durable and which do not hurt the child. Maintain peace and quiet time may be ever for a short period. The child should be encouraged to sit or lie down. The parents must read a book holding the child on the lap. Have strict regime with clear cut rules, definite assignment, and direction is preferable even for routine activities like going to bathroom and shopping. Do not over control or overprotect the child. Do not control or overprotect the child. Child should not be allowed to take excessive tea, coffee, chocolate, and synthetic drinks. Do not keep valuables, breakables, or dangerous objects within easy reach of the children as they are more prone to accidents. Do not threaten, forbid, or correct the child as after a while child gets used to shouting and he does not pay attention to the words. I think you love this video. If you like it, kindly subscribe and also give your comments. Thank you very much.